Hello, this is Chloe Devon, and I am in Dr. Henderson's class. This is the case study number part 1. This is the history of the client. My client's name is Rachel. Rachel was assessed at the age of 3 to begin ABA therapy, and she is now 10 years old. I was not at the current clinic that I'm at when she started, but I have worked with her for about 2.5 years now, mostly every single day, 5 days a week, or 4 days a week. And so when Rachel first started, she was diagnosed with apraxia and autism. And apraxia is a speech disorder when your oral motor functioning is, you have a deficit in that, and so it makes it very hard to speak. And then her medical history was that she was on sleep medication, and she still is on that medication because she has trouble going and staying to sleep at night. Rachel was nonverbal and did not have a way to communicate with those around her. She would also engage in aggressive behavior towards others and finger biting and behavior on herself. The aggressive physical behaviors that she would engage in would be scratching, pinching, slapping, kicking, and she would pull hair sometimes, but that wasn't one of the main aggressive behaviors. But she did have pretty bad physical aggression, and she would finger bite herself. And these behaviors, plus her lack of a functional way to communicate, created that need for behavior analytic services. The assessment chosen for Rachel was the PEAK assessment because that was the assessment that matched her needs the most. This is also one of the 2 main assessments that my BCBA uses. So mostly at our clinic, we either use PEAK or VB-MAP, and that's just going to depend on what that certain client's deficits are and which assessment really fits that individual's needs. And then her behavior change goals. The behavior change goal for Rachel is to decrease physical aggression. And so that was always a behavior change goal for her, but they had tried multiple interventions. And then when I started working there, we used a DRO procedure for Rachel to decrease that behavior because it had gotten very high. This goal was determined by taking data on her aggression, noting that it was increasing over time rather than decreasing or staying the same. So there was a point about a year ago where my behavior analyst and I, because we worked the most with her, started to notice that her physical aggression, the data was a lot higher than it normally is. And so that's when we decided to implement that DRO procedure. And that procedure really just looked like we would explain to her the rule of no hitting, no pinching, no scratching, no kicking for the next 2 minutes. And then we would ignore the behavior during the procedure. And then at the end, we would ask, after the timer went off, we would ask her, did you follow that rule or did you not follow the rule? And she would have to tell us yes or no. And if she did follow the rule, then she would get whatever reinforcer that she had stated that she wanted to work for. And if she said no, we would allow her another chance to get to that reinforcer. Or we would say, or you could have this, like it was a lesser reinforcer for her. So if she wanted to go to the playground when she finished the procedure, or if she wanted to go to the playground, then I could offer her the iPad instead if she didn't follow the rule for the DRO. So we use DRO without extinction. And then some common functions of problem behavior. These are just the 4 main functions. Tangible, which is access to reinforcers, attention, wanting others to give them attention so they engage in the behavior. Self-sustained is just self-reinforcement. The behavior itself is reinforcing. And then escape is getting out of work or getting out of aversive situations. And then we did conduct a functional assessment on Rachel, and it was shown that her behavior is escape and attention based. And so she engaged in the behavior most during those two conditions, and that's how we knew to implement that DRO procedure and not to give her attention for it and not to let her out of discrete trial training. Yeah, so that's my client.